Well, good morning and welcome to the Law Show. Bob Kerrigan with you this morning here on Channel 3. We are broadcasting regularly at 9:30 every Sunday morning. We're on for an hour, and we respond while we're on the air to text messages. So you can text message us at our main number, which is 444-4444. And of course, with text messages, you have to use 850. But if you contact us during the show, we'll answer immediately and tell you whatever we know about the subject that you're asking about. We welcome comments from our viewers on things they'd like us to talk about. Our firm, Kerrigan, Estes, Rankin, McLeod, and Thompson, is a firm that specializes in injury and death claims. We have, however, been involved with many other kinds of cases through the years, particularly environmental cases. I've been involved in major environmental cases across Florida, and we consider other kinds of litigation depending upon the nature of the case, but our primary emphasis through the years has been on these serious injury and death claims. I've said this before, and I'll say it again, maybe every time we're broadcasting. We do not believe in frivolous lawsuits. We think that lawsuits should be carefully considered and very thoroughly investigated before they are filed, and that you should have a meritorious claim or it shouldn't be filed. And under no circumstances will we file a lawsuit solely to extract a settlement with no intention of seeing the lawsuit through. The vast majority of cases are settled before trial. But the reason they settle is because insurance companies and corporations know that if they don't settle, a local jury will determine what a fair amount of damages are in the case. And so to avoid that uncertainty of what damages the jury may award, settlements are reached, and you've no doubt heard the expression settled on the courthouse steps, and that comes from the understanding that if you're going to go through with the jury trial, you're going to be bound by what a local jury determines to be the fair amount of damages. And of course, a local jury can determine there is no fault on the person being sued, and therefore the person who brought the claim would not prevail. That's possible, and that's one of the outcomes that causes people to consider settling a case. That is the chance that they may lose the case that they intend to file. Now, I've kind of beat this subject to death, admittedly, over the last several weeks, and that's this subject of Medicare. So it's over now, this selection that you make, whether you're going to go with one of these private insurance companies or Medicare. But I'll have some overview comments about it, that through the year, as you anticipate the renewal period coming up next year, what you'll decide to do. And in that consideration, understand this, that you have Medicare when you reach the retirement age, and assuming that you otherwise qualify, you have Medicare as a matter of right, Part A, and you can buy Part B for $145 a month. If you elect to, you can also purchase from private insurers approved by Medicare a drug prescription plan. And there's the option of providing you with a substitute for Medicare called a Health Advantage plan. Now, these Health Advantage plans have to be approved by Medicare, so there is a government bureaucracy that approves the plan that's offered to the public. But here's the concern that I have, and the more I look into it, the greater the concern. And so over the next few months, we're going to continue to look at Medicare, try to understand it, try to be have a level of expertise that helps our viewers as they go through the year and then anticipate next October what they're going to do in terms of going back to the normal Medicare or electing one of these private insurance plans. Understand this. When you elect a private insurance plan, like one of these Health Advantage plans, you are not involved in Medicare. You are involved with a private insurance company that's been approved by Medicare, and Medicare is paying that private company a very substantial amount every month for you to be insured by this private insurer. You don't have Medicare. You have private insurance that Medicare has approved. And it's up to you to understand what that private insurance provides. So you go to Medicare.gov, that's the government site, and you look on the site, and then you put in your zip code, address, and then up pops a list of plans that have been approved by Medicare, these health advantage plans. So, healthcare advantage plans. When you review those, though, there's nothing comparing the plan that you're reviewing, and it's just an overview. It's not an in-depth portrayal of the plan to the point of actually seeing the written plan itself. You just get this overview of it, but it doesn't compare it to Medicare. So you really have nothing to really compare it to. And as I've explained repeatedly, the problem with these healthcare advantage plans is that you are in one of these plans, you get seriously ill, and all of a sudden the free eyeglasses don't count because you're going to be faced with huge deductibles or other charges or other limitation of benefits that you didn't realize existed. Just because Medicare has approved the plan doesn't mean it's a good plan. It just means Medicare has approved it. A governmental agency has approved a plan. And we all know this, that the lobbyists line up 10 feet deep around a giant pool of money called Medicare. And these companies, and there's a bunch of them, they have been advertising in the last 6 weeks to 8 weeks to have people sign up. There's a number of these companies out there. There's going to be way more next year. The goal will be to completely dominate the entire Medicare field to the point of not 35%, which it is now, but 100%. So what we're going to end up with in this country is a Medicare plan that's really a private insurance company plan where people cannot possibly compare these plans. They can't compare them. You can try to compare them, but you can't really compare them because you don't know what illness or disease you're going to have. So how do they get you into this? How do you get into this predicament? Well, you sign up and you think, wow, that's a zero premium. That's terrific. And I get a ride to the doctor and I get some other kind of benefits. Sometimes they advertise benefits you already get with Medicare. And they tell you that you're going to get some kind of free eyeglasses and then maybe, a trip or something, whatever the pitch is. Then in the fine print, you find out that, in fact, you only get one of these so-called benefits. You don't get them all. Depends on the plan. So I'm going to go back and read something. I've covered this before, but I just want to highlight how bad this is and to tell you that over the next year, 6 months anyway, we're going to be looking at all aspects of this to try to understand how these healthcare advantage companies are operating now. We know this. We understand this. In the fine print, they get back what they give you for glasses if you ever have an illness or disease. They get it back in multiples. We know that for sure. We also have heard from healthcare providers that these advantage plans that the people that process the claims for them, they have a proclivity to deny claims and to make these healthcare advisors appeal denials of the claims and delay. And small hospitals, particularly, are greatly disadvantaged because of the delay and many times have to accept a lower repayment than they should be getting. What we want to understand, because Medicare is so huge in this country, it is just mammoth. We want to try to understand it. When I looked at this, I didn't find any advocates for you and me. I didn't find any. I found advocates for each plan. I found government advocates. I found a whole cadre of middlemen and middle persons or whatever making money off of this. But I didn't find an advocate that is solely dedicated to the best interest of people who've worked all their life to have Medicare. Who's your spokesperson? Who's your advocate? Well, you'd think it'd be your congressman or your senators, but they're not. They don't even talk about this. First of all, I think they don't understand it. Most of them have no idea of the complexities of this. But there's no incentive for them because it is so convoluted and so confusing that even if they try to be an advocate for the public, it doesn't really work. What we need is an ombudsman in this country for the private citizens of this country, for individuals who are entitled to Medicare. We need an advocate, somebody speaking for the people. And we don't have that right now. I can't find it anyplace. I've Googled it and looked at it, and every time I think I'm onto something, I find a newspaper reporter, for example, who's written about it and who seems to understand it, but no real advocate to the policymakers in this country. So let me just read this caveat. If you remember with the Joe Namath commercials on the screen, they had all this small print at the bottom. You couldn't possibly read it. It's put, I don't know why it's put up there. I guess there's some government requirement for it, but it's impossible to read. But let me just cover a few of the high points. First of all, it starts by saying expanded benefits will be available as of January 1st, 2019. Well, this is for 2021. So the disclaimer on the screen is 2 years old. And it says, enrollment in the described plan type may be limited to certain times of the year unless you meet certain criteria such as qualifying as a special enrollment period. Nobody understands what that is, by the way. Maybe the people who wrote this understand it. The Medicare coverage hotline is not affiliated with or acting on behalf of any government agency or program. Now, you remember how they all advertise using the word Medicare? The government allows them to do that. Oh, you can use the word Medicare and you can pitch anything you want. Try to sell it to the consumer. In the next segment, and this goes on, to the point of everything that was indicated in that commercial, virtually everything, is caveated to the point of saying, well, not quite. You may not get this, you may not get that, you may not qualify for this, you may not qualify for that. These were all come-ons. And that commercial was for a funneler or a referrer that sent your call to some company and you had no idea who that company was. You could not know who it was until you were talking to them. And thank you so much for the emails I've received from people saying they just stayed with Medicare, as I've advised people to do, and they didn't bite on some of these commercials for free eyeglasses, a hat, or a hearing test, or something else. In the next segment, I'm going to talk about false and misleading statements that people make for their own financial benefit and to the detriment of others. Invariably, these schemes harm our elderly and harm those without education to understand what they're getting into. We'll cover that in the coming segment one time here during the Law Show this week. Bob Kerrigan speaking for Kerrigan, Estes, Rankin, McLeod, and Thompson, and thanking you for watching the Law Show.